Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi. Assalamualaikum warahmatullahi. Bismillahirrahmanirrahim. Alhamdulillahirabbil alamin. Wassalatu wassalamu ala asyrafil anbiya'i wal mursalin wa ala alihi wa sahbihi ajma'in. Subhanaka la ilma lana illa ma 'allamtana innaka antal alimul hakim. Rabbi shrah li sadri wa yassir li amri wahlul 'uqdatam min lisani yafqahu qawli. istifadah dalam wabtigha wajhillah wa mardatihi wa qurbihi wa sawabih amma ba'd. So I will talk about the basics of phlebotomy today. We will have a session, a lab session on phlebotomy first. Okay. On the 3rd of November. Ya, Syakira, 3rd of November, Wednesday, from 8 to 11. And you will have a 30 minutes break before the next class with Dr. Arshad start at 11:30. Okay, I made the arrangement already with him. So we need to be on time on the 3rd of November. You need to wear proper PPE. So bring your own lab coat. If it has not been washed, please wash it first. Okay, kita dah lama tak masuk lab kan. Right. So every classes, the next 3 classes, basic of phlebotomy, the blood smear, etc., that I will be giving will be related to the practical labs. So you need to be present and listen carefully. And during the OSP, some of the things that we do in the lab, as well as in the lecture, will be assessed. So there are materials from lectures that we may not cover during the lab, but could also appear in the OSP. Okay. So here I'll be teaching you the theory component for phlebotomy. It will be quite comprehensive, and even the medical students, they do not have the kind of lecture that I'm giving here. Okay, so first, when we talk about phlebotomist, the person who perform phlebotomy, what kind of person do we need to develop, to train, and what criteria will make someone a good phlebotomist? So firstly, they need to be a person who is calm and compassionate, because phlebotomy involves all sorts of people, kids, adults, people who are anxious, people who are aggressive, people who are in lots of pain, like burn victims, accident victims, chronic patients, people who have lots of expectation. So you need to make them at the same level as yours first. You need to be in control, and you need to calm them down if they are anxious. You need to explain properly, make sure that they listen to you. If they are anxious, they don't listen to you, they will not cooperate. And you must show this compassionate in your manner and in your speech. Example is when we see someone who is restless, nampak gelisah. So the easy thing maybe just to carry on doing the phlebotomy, cucuk je jarum, or you may want to be compassionate by asking, what's the problem? Do you need time to do this? Or perhaps the patient is not comfortable with who we are for whatever reason. So we may want to ask, do you want me to do this, or you prefer my friend to do it. Or maybe the person is have been waiting for some time and eager to go to the toilet. Yeah, the elderly, for example, they are too they respect the medical healthcare personnel so much. They don't dare to request a short trip to the toilet. Yeah? So we can be compassionate, be sensitive to all these things, and offer them some time. The person must have very steady hands to control their hand movements, and sharp minds, because lots of things could happen unexpectedly during a phlebotomy session. If you have an aggressive person dealing with people with mental health illnesses, for example, they can turn abruptly from being calm to being very aggressive. Yeah, you must train your minds in how to deal with such abrupt turn of events. A person who is good phlebotomist must be always smiling and cheerful, and must be able to communicate well. Communicate well means that things are clear, things are being told to the patient in the systematic manner. Okay. We will have a practice on the communication skill as well during our lab session. Yeah, I'll give you a manual, and there are 3 parts to phlebotomy: the pre-phlebotomy, the during phlebotomy, and after the phlebotomy. And all 3 phases will require you to have a very good communication skill. We will see that later on, yeah, during the lab especially. And in lots of cases, you need to have a high level of patience. Some individuals, like kids, they are very innocent. They may need special attention, meaning time. You may need to have a good posture. When dealing with kids, it is advisable to be at the same level as them, meaning because they are short. So if you stand up while talking to them, it can overwhelm the kids. Yeah. So it is best to stoop or to sit down and talk to them at their level, and then ask them for consent, ask for their cooperation, involve them in the process, and that will ease the procedure. Okay, finally, because there is a lot of standing, you need to have a very strong feet. Yeah, a lot of standing and a lot of walking will be involved when taking blood collection. Okay, what is actually meant by phlebotomy? Yeah, phlebotomy, the original word means to cut into vein. Okay, to cut into vein, but the practice has changed. When we talk about phlebotomy, it's no longer restricted to vein, collecting blood from vein, but also from arteries. Okay, before I continue further, can I just check if you can hear me clearly, and is the slide moving?
Yes, doctor.
Yes,
Okay.
doctor.
Good, very good. Okay, so phlebotomy is a procedure in which we cut or puncture a vein. Yeah, and the person who do this is called phlebotomist. It could be a person who hold the position of phlebotomist in the hospital in the clinical setting. It could be a student, it could be medical doctors or nurses, and etc. So the primary role of this person who is getting the blood sample is to obtain blood specimen that could be used for testing. Okay, could be used for testing. So that is very important. Yeah, I would like to underline that, because if anything happened during the blood taking that make the sample useless, yeah, useless, could not be used for testing, So the purpose of the blood taking is not successful. So you defeat the purpose of doing it. The phlebotomist may routinely be asked to do some additional tasks like collecting blood sample, also maybe at the counter to accept incoming specimens, and also helping in routing specimens to other departments. Yeah, so the scope of job would differ slightly from places, one place to another. Okay. In the past, we perform the cut with a sharp instrument to drain the blood, and lancet was the most popularly used instrument. The technique was known to the ancient civilization, and the aseptic technique were not very well practiced. For example, lancet was reused for several patients, but these days, phlebotomist as a profession or as a career has emerged and regulated as a result of technology and expansions in laboratory functions. And the person who are doing it, they are trained. When you see a phlebotomist, they have to be trained, they have to be certified, and they involves people who are professionals in their job, nurses, doctors, in addition to those who hold the position of the phlebotomy themselves. And there are agencies that regulate the function and practice of phlebotomy. One of the most commonly referred to standards of practice is by the Clinical and Laboratory Standards Institute. This is in the US, but we always refer to their standards. Yeah. Okay, roles and responsibility of a phlebotomist. Yeah. Firstly, when we want to take blood, we need to identify patient. And how do we do this? Firstly, by checking the armband, gelang pada tangan tu, or any ID label. Like on the bed, there might be a file at the end of the bed, so you need to check this. If there aren't any hospital tagging or has hospital notes around, then there are documents that can be used to double check their identity, like driver's license, and whatnot. So you need to ask, can I have your ID? That's one of the question that you can use. You can also say, I need to check your identity. Can you tell me your name and your date of birth? And double check this with the information that you may have already. Bila kita datang kat patient tu, maybe we already come with a document, with a form, with a request form from somebody saying that Sister Nur Akilah at what sekian need to be having her blood taken. So we can ask, can you tell your name? So when she is able to tell the name and giving the right ID number, then we can consider that we have compare and validate the information. Even if there is any tagging on the bed or at the patient, we need to ask again, can you tell me your name, and then compare with the tagging and then validate. Okay, so that is the responsibility of a phlebotomist to ask. Do not straight away go to a patient and start poking around with the needle. If something happened, for example, there is injury to the patient, and the patient bring the case to the hospital, to the court. You will lose in the court case if you do not do the scope of job, the responsibility that is expected from you. So Again, proper identification is this 3-step process to ask, to compare, and to validate. Remember this, I may ask this in the OSPE, just giving you a piece of paper, asking about the proper identification during phlebotomy. Right. Okay. So after you have checked the identity, then we want to do the specimen collection and we want to handle. Okay. Normally we get a request order indicating the type of specimen and maybe in some cases what time do we need to take the specimen. Yeah. Maybe there are procedures that has been scheduled before. So the blood must be taken at certain time points. So most commonly used method, we have venipuncture. So phlebotomy is commonly mentioned interchangeably with venipuncture. Yeah, tapi kalau orang cakap venipuncture does not restricted to the use of needle into the vein. It could also mean blood taking in general. Yeah, in general. Okay. But if we talk about venipuncture in a specific term, this means the insertion of a needle into a vein to remove blood. Yeah, we need to qualify that statement. Yeah, what needle, which vein, how much blood. We still need to qualify that statement. But that is the general definition. Now we can also take blood specimen using dermal puncture. And this is by the use of a puncture device, okay, to obtain capillary blood. Okay, capillary. The venipuncture is for vein. Dermal puncture is mainly to collect capillary blood, and we do this by pricking the skin. Okay, and people who are doing phlebotomy, they need to exude confidence and show professionalism. Look at this guy here. What do you think? Office member Nurul Ain Farhana. Okay. Office mana ni?
Sorry, doktor. Saya lupa nak tukar.
Saya pun tak tukar saya punya background. No problem. Okay, what do you think of this guy? Which one do you think is the phlebotomist?
With the yang lab coat, white lab coat tu lah, of course.
Okay.
Basically asking patient code for a detail.
Does he look professional?
Yes.
In what way?
By wearing the lab coat.
By wearing the lab coat. Yeah, it's such an simple thing to do. Wearing the lab coat. Okay. How about the guy who is sitting? Does he look professional?
No.
But if he wears a lab coat as well, you may count that as professional. Okay, so that's good. Okay, so one of the mark of professionalism in healthcare setting is by wearing an attire which represent that professionalism. Yeah. So in healthcare setting, the commonly used representation is the uniform. Yeah, the uniform or the lab coat in this case. Okay, so be professional, apply good interpersonal skill, dress professionally. Yeah, many institutions require that phlebotomists wear a specific lab jacket, and even some of them require specific shoes. So in this depends on individual hospitals. Yeah, why do they need to wear specific shoes? Because they are involved in they use sharp materials. Yeah, so if you are protected, if anything drop, anything sharp drop to your feet, you are protected. Yeah, also you are involved with a sample which is considered very hazardous. Remember, blood is the most common sample. You see it all over the place, yeah, being taken all over the place, and contact to your skin. We do not know. Maybe there is a wound to your feet. So if you are in contact with blood specimens, you may get infections. Yeah. So professionalism is not only about dressing, but also about how we speak. So that's why training is important. How do we ask? For example, how do we ask? Should we use slang? What kind of
No.
slang? No. It depends. Yeah, it depends. The kind of slang that may be inappropriate, maybe the kind of slang that the WeChat generation like you guys, yeah, maybe using during your conversation. Okay. Apa ni? Terms that other generation may not understand, like poyo, the word poyo. For example, you said, will you use patient ni poyo lah. That kind of thing. So the patient does not understand. Saya pun take some time to understand what does this poyo means. Yeah, and it's so that kind of of words. Yeah, but there are dialect. Yeah, dialect. Which you may need to master and use. Yeah, if you are working in Kelantan, for example, okay, you need to be able to show that you can speak lah in the Kelantan speak. When you want to deal with the patients. Likewise, if you are working in Kedah, Kedah dah cakap Kedah, kan? Akan lagi senang lah dapat cooperation. Okay. So that kind of situation, it becomes advantageous to use local dialect. Yeah. Although you must be careful not to lose your professionalism, not to be too intimate or too showing that too familiar. Yeah. Familiarity ni kena jaga, so that we do not lose trust and respect from the people we deal with. Right, and we need to talk in a calm and clear voice, avoiding inappropriate terms, maintaining eye contact. Yeah, if you look at the first picture just now, the person was writing without looking at the patient. We do not know the whole context lah. Maybe masa tengah nak ambil gambar tu, dia tengah menulis. But when we are writing even or talking to the patient, we must always have an eye contact with them and need well-groomed appearance. Okay, respecting personal space, especially if different gender, not too close, etc. Phlebotomists must be able to communicate using non-medical terms as well. Okay, you communicate non-medical terms to the patients, but you need to use proper medical terms. You need to learn that with your colleague and with other health professionals. Okay, when providing customer service or this patient-oriented service, we must be empathetic. We must put ourselves in the place of the patient. We must be sensitive to their needs. So, as I mentioned in the earlier part of the lecture, we must observe how do they behave. If they are restless, ask them, why are you restless? Can we start now? Are you comfortable if we start now? You want to do it later on? Are you waiting for something? Yes, just this small talk, yeah, may ease the patient. Make sure that you have empathy to them. Listen to their concerns. They may be agitated because they see your needle. I do not know. Yeah. You will need to assess people's individually and according to the context you are in. So you need to address any situation promptly and be flexible. Okay, the patient said, "Yeah, I've been waiting to go to the toilet. I've been waiting for you to come for the past 30 minutes. I was afraid that if I go to the toilet, you may miss me. So I've been holding myself. Yeah. So you can say, okay, tak apa pakcik, you can go to the toilet. I will wait. Yeah. Don't rush. Take your time. So you be flexible. You know their concern, and everything will turn out well. Okay. Where can we see phlebotomies at work? Yeah. So phlebotomies could be working in an inpatient facility. Patutnya ada sempang tu. Like in hospital, okay, in nursing homes, and rehabilitation centers. Yeah, rehabilitation centers. Dekat Malaysia ni dia macam ada institute for, panggil apa institut kerja apa lupa, dia untuk institut kesihatan pekerjaan contohnya, ya, ada masa dekat saya dulu in the UK they have rehab centers for stroke, for neurological disorders patient, ya, for also for stroke, also for post surgery. So they have a rehab center. So it's not a hospital, it's not a nursing home. Patient comes in from their house, then they get attention, medical attention. There is a medical team attending them. There is a consultant there. They are being trained how to walk, how to do normal things that they no longer can do because of their problems, because of their medical issues. So they are being trained. So these are rehabilitation centers. Rehabilitation centers also could mean places where drug addicts, yeah. So they will be put in rehab centers for drug addicts. So you need to I mean, phlebotomists may be working in that kind of situation. So the phlebotomists employed at inpatient facilities work directly with several members of the healthcare team. This is to underline that the phlebotomist is not a single entity, it works as in a team. They could also be working in an outpatient facilities like physicians' offices, home healthcare agencies, ambulatory care centers, ya, maknanya macam ambulance, macam in places like Jerantut, ya, we have apa ni panggil hospital atau klinik bergerak, ya. Kalau kat Jerantut tu very special, dia naik boat pergi kampung orang asli. Now we do sampling, so phlebotomists will be asked to do that as well. And then reference laboratories in blood bank. Okay, so there are agencies that regulate the practice. As I mentioned, the Clinical Laboratory Improvement Amendment, CLIA, in the US is one of the major reference point. Yeah, I mentioned it, although it is USA, but they developed this first. So, and we tend to adopt what they have formulated. It was established in 1988 to ensure that all labs meet the same standards. Okay, and by 1992, this legislation became the main regulatory body for all laboratories. So in the US, this is the agency that certify phlebotomies. As I mentioned previously, we are yet to have a proper certification agency to look after for the need of phlebotomies. There are also other agencies, okay, like Centers for Disease Control USA. So this CDC is highly regarded, internationally renowned, and they've also our main reference point, especially when dealing with new infections, new pandemics. Yeah, how do we deal with that? So they will give their input. So like every single new infection that occur these days will be referred to CDC. So something that happened in Wuhan was sent to CDC first, and then people will be waiting for CDC to to provide advice. Nipah virus pandemic in Malaysia, when it happened, we were the only country that was affected at that time. And we took the sample, we sent to CDC lab in the US. So CDC ni memang penting lah, I say basically. Health ministry in each country also play regulatory role. And then we have also regulation enforced by the Osha, yeah, Occupation Safety and Health Administration, and also the Clinical and Lab Standards Institute. Again, this one is in the USA. Okay. When we do phlebotomy, there is a need to control and oversee risk of safety and infection. Okay, this infection by infectious agent can be caused either by direct or indirect contact. Okay, so indirect contact, how could it cause infectious disease? For example, if the contaminated item is handled prior to contact with a susceptible host, so person to contaminated item to person, like including even the vial of the blood specimen. Yeah, direct contact requires transfer of pathogen from reservoir to a susceptible host, person to person. So indirect, they involve perantaraan, which may be in terms of the material, yeah, contaminated item ni, but the direct is from the person who is infected directly to us. So a person with COVID-19, for example, could cough in front of a Flabotomys, yeah, and that could be a direct contact. You can get, because phlebotomy ni dia memang a job which is having a very close contact to the patient. You need to touch, yeah, you need to be very close, yeah, berhadapan terus dengan patient. So direct contact infection is a big risk. As a phlebotomy working in hospital setting, etc., you need to understand that the risk of nosocomial infection is very high, and but the good thing about a lot of these infections is that they are preventable if we take precautions to break the chain of infection. Yeah, so if we have the infection agent, okay, and the reservoir or the patient who is infected, we may know the portal of entry, coughing, aerosol, sneezing, etc. And we understand the mode of transmission and how it could affect us.
Okay, Dato', saya dah tukar setting.
Where are we? Can you see my slide? Okay, we were here. So I can see that I'm a bit behind time. So I'll be quick, maybe 1 minute to finish off this first part. So I was talking about nosocomial infection. It is breakable if you understand the whole process and we do the precautions. Yeah. So there are advices from the CDC. Standard precautions must be applied, combining good hand hygiene and the use of gloves, and then practice isolation for those who are exposed. Okay, hand washing. I'm sure you have had many courses on hand washing. If performed correctly, it will reduce the risk of transmitting infection. We will need to remove all rings and jewelry, wet hands thoroughly using warm water, apply antibacterial soap, and then interlace fingers using friction to cleanse the hand. And then use an orange stick or hand brush to clean under fingernails or cut the nails. Yeah. And then be sure not to lean against the sink area. Raise each hand with fingers pointing downward and keep fingers pointed downwards so water and leather will drain toward fingertips. Turn water off and dry with paper towels. Turn off water or the tap with a clean paper towel if needed, and clean the area of the sink without recontaminating the hands. So we will do this during the lab as well. And then CDC also advised on the use of alcohol-based hand rub. But before we use, we must make sure there is no visible dirt or contamination. We must apply half to 1 teaspoon of alcohol cleanser to one hand, meaning when we press, we press the bottle, they should give us that amount. And then rub the hands together vigorously, making sure all surfaces are covered. Continue rubbing until hands are dry. And then CDC also, as well as the Osha, they also advise on the use of gloves. Okay. So it's part of the PPE, and there is a way to use the glove without retouching the area that has been protected. Okay, there is a Needle Stick Safety and Prevention Act, which has been advised and recommend. There are recommendations by NIOSH and OSHA. One of it is the mandatory use of safety devices on needle in order to prevent exposure to blood-borne pathogens. Okay, in the US, they have Health Insurance Portability and Accountability Act. I believe we don't have this yet. So I'm just using this as an example. They establish a national standard for this to protect the privacy and confidentiality of patient information. Yeah, and patient information can be shared for treatment purposes. Kenapa Shakira? So this is all about patient information, to protect about the confidentiality. How would you treat the information related to the sample? Code of ethics, okay, etc. So the last part is patient. We must know that any phlebotomy procedure must have a clear consent. Patients have the right to firstly refuse care and be treated with respect, have all their record information kept confidential, be informed about the purpose and expected result of treatment, and if they want, they can have access to their medical records. Okay, so that is the first part, introduction to phlebotomy. So as to recap, we must know the definition of phlebotomy, the job scope, roles, and responsibility of phlebotomists, the risks involved with phlebotomy or blood taking, and some acts, some regulations that are in place. Now, let's go to the phlebotomy itself. Okay. Bersedia semua? Shakira, what can you see on my slide?
Specimen collection equipment.
Many equipment. Can you name them? Boleh? Excellent. In the OSPI, I'll give this kind of picture or real thing, and you need to name. So can you name at least 3 things that you can see on the slide?
Pen, glove,
Okay.
and
Writing material.
tube.
Sorry?
EDTA tube.
Pen.
EDTA tube.
EDTA tube. Excellent. Lagi satu.
Alcohol swab.
Alcohol swab. Okay. Let us call upon Shakira lah. Shakira, you call upon your best friend to answer, to give me the. Nanti kalau Shakira sebut nama bergaduh lepas ni. Tak apa. Najia lah, Najia. Najia, are you there, Najia?
Yes.
Okay, can you name 3 things on the slide apart from those that have been mentioned by Shakira?
Ghost pad.
Yeah, ghost pad clearly written there. Lagi?
Bandage.
Yang kuning tu apa yang kuning tu?
Glove.
Gloves. Okay. And the third one? Najah, nombor 3. Barang yang ketiga. Awak dah tak cakap ni. Okey, Najah. Potong markah satu Tak dapat satu lagi ni. Apa yang jadi ni? Tak apa, tak apa. So
Yang tu apa? Macam pelekat dulu.
yang mana macam pelekat? Yang ni?
Yang tu.
Okey, pelekat lah. Cakap pelekat tak apa.
Pelekat.
Markah satu markah dapat balik. Kita panggil selotip, kita panggil pelekat. Okey. Ada banyak lagi ni Ada yang warna merah ni. I hope you can name it because we have been mentioning its name. This blue, nak kata apa? Ini bukan ribbon but it's a tying material lah. We call it tourniquet. Okay, tourniquet. Then the sharp beans, kita ada kita panggil apa ni? The syringe, the needle is pads, gauze pads, adhesive bandage, needles, evacuated tube or syringe, evacuated tube holder, this one here, evacuated tube, sharps, container, permanent marker, pen, or maybe computer labels. Sometimes people carry around pen. Ini apa? A source of infection on its own. Kita pegang sana, pegang pen, pegang sana, pegang pen, transfer everywhere. So and tulisan boleh jadi apa tersalah, the pen dia punya ujung tu mungkin pecah, and then when you write you cannot write properly, you smudge the whole form, sometimes the dakwat habis, pen hilang, macam-macam lah. So we have computer labels this day. So even the names of the patient is written clearly, legibly, and correctly. Okay, let's look at the gloves. Made of either latex or vinyl. Normally they are sterile, but there are also non-sterile ones. You can use any of those. Powder-free gloves are recommended because the powder can serve especially a sweaty type of person. So bila dia pakai glove tu dia sweat. So when you use the powder, this is better for them because it makes the glove wearing the glove more comfortable. And as part of Osha regulation, gloves must be worn throughout the phlebotomy procedures. And if there is any torn, any tear to the gloves, they must be replaced. And you need to wash hands after removing gloves. Don't think that if you are wearing hands, it's protected, it's clean. No, it's part of the regulation is that you need to wash your hands still after removing the gloves. And be alert to latex allergies. Some people they develop allergies after they take off the gloves. They may find that there are itchiness, redness to their hands. Okay, so you need to use a latex-free gloves. Tourniquet, it could be. This is just a device that is wrapped around the arm to stop the flow of venous blood. But the stopping of flow is done only temporarily. Berapa lama tu? 2 minutes, not more than 2 minutes. If not, then you can patient will become uncomfortable because they become apa panggil kebas. They become kebas, and if it is longer, they may lose blood to fingers, etc., and can cause damage. So used to locate the patient veins easily. You can use any kind of tying material. Yeah, we have the latex-free tourniquet, which is stretchable like this. Yeah, latex-free tourniquet, stretchable. You can even use gloves. Gloves tu koyakkan sikit, boleh ikat, jadilah dia tourniquet. But the commercially available one, they are commonly disposable. They may be cleaned for reuse on same patient if not visibly contaminated. Yeah, and not more than 2 minutes. I said not more than 1 minute. Then types of tourniquet can be non-latex, latex, even blood pressure cuff can be used. Okay, latex allergies and Flabotomy. So you need to understand that this could occur, because a lot of people, they have latex allergy, they present with itchy, watery eyes, skin rash, chest tightness, shortness of breath, and they can get into shock. Shock bukan terkejut. Shock is a medical term denoting there is a loss of blood pressure as well. So dia macam pengsan macam tu lah. But this is rare. Always ask the patient if they are allergic to latex. You yourself need to know whether you are latex allergic or not. Okay, alcohol prep pads. This is used to clean the site where you want to prick the needle into. We must clean that site. Okay, and the alcohol prep pads. Okay, kalau katalah tak ada that commercially available one, you can use a gauze and then put into any bacteriostat antiseptic and 70% isopropyl alcohol, and then clean the area. But they are not recommended for collection of blood alcohol levels, because they themselves has got alcohol. They may change the level of the alcohol in the blood. And you may not want to use them for the blood glucose because they can interfere. Dalam blood glucose vial tu dia ada enzyme, so having the alcohol may interfere with the function of the enzyme. Okay, so adhesive bandage. This is placed over the puncture site for 3 to 5 minutes to stop the bleeding after you have taken the blood. They are normally loose woven fabric, and we need to apply and press on the after needle is removed. Not dia ada cara nanti lah saya tunjuk. Okay. Red roles and responsibility. This is legal how to say this, legal concern lah. If you fail to remove the tourniquet following Venipuncture, okay, this is why you need to be a calm person, very systematic, and you need to do this many times and get it into habit or second nature. So once you have done the Venipuncture, don't forget to take away the tourniquet. Setengah orang dia buat kelang kabut, tourniquet tu lupa nak buka. So patient ni sebab dia respect sangat kat healthcare personnel, the patient does not do anything. Just wait. Kalau kita tak kata kat dia boleh balik, dia pun tak balik sebenarnya. Dia tunggu kat situ. So you need to take off the tourniquet because it can cause temporary or permanent injury. And the failure to do this is considered an act of negligence, medical negligence. Let's look at the needle. So there is the hub and then the shaft, and at the very end there is what we call the bevel. Bevel ni dia macam separuh kena potong sikit lah. Kau nampak ada lubang dia. You can see the hole of the needle. So it varies the number, the gauge, we call the size gauge diameter. The smaller number denote bigger diameter, whereas the higher number denotes smaller diameter. Okay. There are several types of needles used by phlebotomies. We have multiple sample needle, hypodermic needle, and also butterfly needle. We will we will we will exhibit, yeah, the needles, the different type of vials during our lab session. So make sure you do not miss the lab session. We will exhibit. Bukan semua needles ni kita akan bagi pakai lah. At your stage, you just need to be familiar with one type of needle. Okay. Where I mentioned about the Prevention Act. So this is the safety feature, safety feature. So you see, sometimes kita tak pakai, but it is best actually to have this safety feature. The needle should be in its sheath. Lepas tu bila terkoyakkan ni, is still there. Does not be separated. And at the back we have this what we call the adapter, and then we put the vial, the ADTA tube, for example, into this adapter, and then the blood will flow through this this pipe of the wool component. So this one is safer. Okay, we have a better place to have a grip, and then less risk for having safety needle stick injury. Okay. Any needle stick injury must be reported to a supervisor. Okay, this is the evacuated tube holder or the adapter. Should be disposed of after use. Yeah, and then this is the sharp container. This one is white in color. Okay, I do not know why they use a white one. Normally it's red or yellow. Okay. It must be made of non-penetrable plastic and have a biohazard label. Okay, biohazard label. Okay, biohazard macam ni. Okay, so yeah, I do not know why they use a white one. Whether this is nak kata wrong, tak juga. Sebab the design is clearly this is a sharp bin. Okay, but this is one of the maybe apa ni rare example of something which is not conforming to the common standard. Yeah, so you need to be very sensitive and aware, alert to all these small differences in the labs, and in the setting that you are working in, because there are examples like this. Okay, computer label, permanent marker, and pen. So each tube must be labeled. So you need all this material. You need to have patient name and ID number, their date and time of collection, and also the collector's initials. Okay. How many minutes do we have before we stop?
I'm not sure, but the 40 minutes.
Can you? Okay, can we take a 2 minutes break because I need to arrange for my kids PDPR. Just 2 minutes.
All right, sure.
Okay, let's resume. So I've mentioned about the different types of vials. Okay, or we call them evacuated tubes.
So they have different colors, yeah, different colors at the at their top, yeah. So they all have a pre-measured vacuum. So bila nanti awak ambil darah, insert to the vial. You don't need to press. Yeah? Sorry, another distraction. Yeah. Okay, so the evacuated tubes, like range in size from 2 mil to 15 mil, and there are tubes for adults and also for pediatric or for small children. Okay, multiple tubes may be required for collection of various specimens, and the order in which we use the tubes is very important. Yeah. This rule is called the order of draw. Okay, sorry, I do not have the order of draw, but basically the blood glucose must be last, and then the blood for the bacterial must be first, yeah, so that we don't contaminate the blood that we want to use for checking whether there are infections in the blood or not. Okay, so tubes and anticoagulant. In each of the tubes, yeah, we have anticoagulant, whether it is heparin or EDTA. This is to prevent the specimen from clotting. So any specimen that is showing evidence of clotting should not be used. That's the basic rule of thumb. Okay, and in order to ensure that they do not clot, and the blood need to be mixed well with the anticoagulant. And how do we do this? Is that we turn the vials a few times, okay, invert them a few times to ensure uniform mixing has taken place. So okay. But be careful not to shake aggressively. Just a gentle inversion. Okay. This is the order of draw. Trial specimen for blood culture tubes, and then we use the coagulation, those with the coagulation tubes, and then the SST, and those that we want to use for serum analysis. Okay. This is a butterfly infusion set. You may have seen this. Okay. In normal cases, we take one sample using the syringe and the needle, and that's it. Yeah. But in certain cases, we may want to use a butterfly infusion set. Okay. In cases like in people who have small fragile veins, like the elderly and the children, because we want to make sure that next time when we want to take blood sample from them, we have a needle already in place. So it helps us and it helps them as well. We don't need to poke into them many times, yeah? And having great problem finding the vein will reflect on us. Yeah, we get anxious, and then that anxiety will be transmitted to the patient as well. So this system must be ensured to be completely sterile. So we have an adapter as well there, and long tube which is connected to the butterfly. We call that butterfly. We need to put a tape here so that it will keep on attaching to the patient's skin, and the needle is will be in situ in the patient's vein. Okay, other manner or other way to get blood collection is by doing dermal puncture. This is useful when we do not need to have so many blood. We just do a hand prick, for example. Blood may come from arterial, venous, or capillaries. And we do this routinely for infants and small children under 2 years of age. Because it's not too frightening as opposed to the other phlebotomy procedures. Okay. Sometimes we also do this for adults. Yeah, like in cases of severe burns, we could not anymore locate the veins. Yeah, or we don't want them to lose too much blood, so we use dermal puncture. Okay, other cases are like for chemotherapy patients. Again, why? Because we want to minimize the puncture size. Ya, kita tak nak dia orang ni ada luka yang besar. We want to minimize the diameter of the wound. Yeah, because people with chemotherapy, their bone marrow function is being suppressed. They will have less ability to fight infections, and when they have wound, they have less ability to heal the wound. Older patients with fragile veins also could be considered for having dermal puncture. And we also use dermal puncture routinely for home glucose monitoring for diabetes. So this is the dermal puncture device. It has a safety lancet. Anytime we use the lancet, we must still wear gloves, have alcohol pads ready, and swipe clean the area first. Sterile gauze. Once we have done it, we have collected the sample, we must put on sterile gauze, clean up the area, and dispose the needles into sharp disposal container. Of course, in places like home, yeah, where people do this, they do the self-monitoring for diabetes, for example. Sometimes dia orang buang je benda ni dalam tong sampah, not in the proper disposal container. So it is a risky behavior because they can cause injury to the waste disposal workers. Alam flora tu takut tercucuk, yeah? And sometimes in the landfill, tempat buang sampah tu, alam flora dia bawa lori banyak-banyak ni, dia akan hantar ke landfill site, ya. Dekat situ longgokkan sampah. There are people who scavenge for this waste. Kita tak nampak sebab kita tak pergi, tapi there are actually people who do this, yeah? And they may step on all the sharps. If the sharp has got infection, they can get infected as well. So actually, part of the education of patient is on how do they dispose their sharps. Okay, and then they have the micro specimen container to take up the specimen. Okay, to prevent puncturing a bone, this is the risk with using the dermal puncture device. There is a risk to puncture the bone because sometimes we use fingers. Yeah, it's very close to bones, and we don't want the puncture depth to be too deep. If we puncture the bone, we can introduce infection to those bones, and it will be difficult to treat. Yeah? So it has been designed as such so that when we do the puncturing, the puncture depth will not be more than 2 millimeter, just enough for us to get the sample. Yeah? Another site that we commonly use is the heel. Kalau you may not know or you may not see this, but every time a baby is born, we routinely take sample from their heel. Kita tak pakai dia punya fingers because their fingers is very small, so we use their heel. Again, area which is close to the bone, the heel bone. So, but current dermal puncture devices should be safe. Yeah, will not introduce too deep puncture. Okay. We used to have these micro specimen containers. This is something that just for your info lah. Micro specimen containers to collect blood samples less than 1 milliliter. Nanti ada juga kita nak pakai for our hematocrit tubes. Hematocrit lab. Some of these old devices, you will see how difficult it is to use these old devices. Yeah. Okay, micro collection containers. I got 5 more minutes before it stop. Again, the micro containers, they also come with anticoagulants and also have color-coded system. Okay, I think this one. Okay, now patient positioning. Okay, patient positioning is very important. This what you see here is a phlebotomy chair, but this luxury is not always there. Okay, bukan semua tempat ada phlebotomy chair. Okay, don't worry if you don't have one. You just need to know the basic principle of how to position a patient for phlebotomy. Look at this chair. Dia ada tempat untuk rest the arm. Okay, sini rest the arm. That is one of the things that you need. Place to rest the arm, and then the patient is sitting comfortably, and then the arm must be at the same level of the heart. That's why the chair is designed as such. Okay, yang sini is for the phlebotomist lah, to assemble all the equipments and place a drawer to put their equipments, to store their equipments. Kalau tak ada ni, so you just create the same thing. A table, a kitchen table will be okay. A table next to the patient, table makan dia tu will be okay, as long as the patient is sitting possibly 90 degrees lah, macam kita ni kan. Apa ni? 90 ke? Apa ni? 180. 180 degrees. If the patient is on the bed, we need to raise the bed a little bit. Yeah, as long as their hands is at the same level of the heart. Okay, and then straight chair. Okay, pillow or roll up towel can be placed under the arm for positioning. These are all to fix the arms. Yeah. Make sure that when you do the phlebotomy, the hand or the arm is supported. Jangan dia hanging. Jangan dia hanging. Awak suruh dia extend dia punya arm, and then you just do the phlebotomy. No, that will introduce, or that is a very risky position. If, say for example, the patient cough, ataupun batuk yang kuat, so you can imagine that the hand will be moving in a jerky manner. Or imagine somebody accidentally push the patient, terjatuh ke, tertolak orang tu. So if the arm is not supported, a deeper injury could be introduced. Okay, this is the tourniquet. Anything can be used as a tourniquet as long as it could stop the blood flow temporarily. it should not pinch the skin, should be kept flat, should be applied 3 to 4 inches above the venipuncture site. So Nurul Ain, how do you measure 3 to 4 inches above the venipuncture site?
Using tape ataupun kalau dah selalu buat mungkin dah boleh agak kot.
Okay, how do you agak? You must agak in an educated manner. Saya rasa kita semua tak pernah tengok nurses mengukur menggunakan measuring tape. Okay, nobody do that. Okay, so as a rule of thumb, you can use your fingers, 3 to 4 fingers, 3 to 4 fingers. Put here from the venipuncture site. You know where you want to prick. You want to puncture 4 to 3 fingers. Tengoklah kalau tangan debab, jangan letak 4. Nanti terlampau jauh. Okay, kena ni juga. Okay, so about 3 to 4. Average person 3, 4, okay. Okay, debab 3 only. Jangan sampai 4. Okay. So that is where you put the tourniquet on. Got 1 minute. Okay. So the vein will be more visible and palpable. You can also okay, try to make the vein palpable. Okay, I see you in 3 minutes. Yeah, 3 minutes. Right. Okay, now so we know how we should behave, how we should present ourselves to the patients, what are the responsibilities of a phlebotomist, what are things that we must ensure to be worn in terms of the SOP, etc., and the different types of blood taking, blood collecting procedures. Now we come to the selecting the venipuncture site. Yeah, so we must select a vein that is large and does not roll. That's the first principle. So if you look at your own arms, you can see lots of veins there. Yeah, so which one to choose? The rule of thumb is to always examine the anticubital area. Anticubital area ni dekat pelipat sini lah. So ask the patient to hold the arm still and make a fist and open and close the fist a few times. Yeah, and then we can palpate the vein using the tip of the index finger. We can compress or we can give a tap to the area. This could be done to increase the vein size if needed. There are a few considerations that we must think of. Firstly, never select a site that is edematous, membengkak contohnya, ataupun kita nampak dia ada edema, or a site that has lesions. Perhaps there is a scar. Okay, there is a wound, so we don't choose that site. Yeah? If there is an intravenous on that arm, so we never perform venipuncture above the intravenous site. If the person has had mastectomy, we then avoid the arm on that side of the mastectomy. Kalau dia kena dekat breast, left breast, so we do not use the left arm, for example. Okay, with regard to children, yeah, children they are cute and nice to look at, but when they meragam, they are difficult to handle. Yeah, so there are ways to reduce the difficulties. One of the good practice is to ask the children to help with the procedure, so they get involved with it. You can ask them to hold something, yeah, So when they are involved, they are assured that you are a friend to them, so they be complying. Elderly, sensory impairment may exist. They may not be able to hear you clearly, so you need to allocate time for them. Shallower angle, okay, angle of the syringe is normally 15 to 35, so you need to maybe get it at around 15-degree angle. So when you want to insert the needle, this is the things to consider. You may need to hold the skin so that it's easier to get the vein. Okay, with regard to patients who are known to have infections like HIV or hepatitis, blood-borne infection, very common and easily transmissible through blood. Yeah, so we need to use PPE. Those patients with psychiatric problem who may be aggressive, yeah, you must evaluate the patient carefully, and if concerned, you must ask a member of staff to assist. Okay. Hold on, Banyak pula distraction lagi ni, sorry. Okay, now we have selected the site. How do we clean the site? Okay. There's also a recommended practice regarding cleaning the site. Must be performed with antiseptic, 70% alcohol, and then using concentric circles, meaning that when you have the pad, the alcohol pad, you put on the puncture site, and then you move upwardsly in circle. Okay. Never blow on the cleansing site. Never touch the site that has been cleansed. So when performing the venipuncture, mula kita akan letak tourniquet dulu. We then identify the vein. Then we remove the tourniquet. Okay, get all our equipments ready, and then reapply the tourniquet. Confirm again the venipuncture site. Anchor the vein below the puncture site. Insert the needle at 15 to 30-degree angle, and then insert the needle in. And allow the blood to fill up the tube. Okay, blood collection may fail if the needle is inserted too far. Okay, or there is insufficient vacuum in the tube, or the bevel is on the lower wall of the vein. The bevel must be upwards. Okay, it could also fail because tourniquet is too tight. So the tourniquet is supposed to be able to stop blood flow, but not tighten too much. Otherwise, bila kita nak ambil darah tu dia tak keluar. Sometimes the failure can be due to poor site selection. For example, the vein is hard and sclerosed, and if patient fails to maintain a still positioning. So this is blood taking. Amount of blood needed is determined by the amount of additive. Overfilling and evacuated tube is not possible unless the stopper is removed and blood is added. Okay. Make sure that after we have the blood inside the tube, we then invert. And sometimes we need to take multiple samples. So brace the thumb against the flange of the holder, remove the tube with a pulling and twisting motion. This will come with practice lah. Yeah? Macam mana kita nak make sure that the needle is still inside the vein while changing the tube. So when you have the opportunity, we don't do this in our lab, but when you're out working as a phlebotomist, when you have to do this, do it confidently. It is okay. It is a safe procedure. Just make sure that your fingers are fixed. And these are the things that we will touch on during the lab session. So don't miss your lab session at all. Okay. So we must put the gauze directly over the area of the needle insertion. After the needle is removed, engage safety mechanism if you have it, and then apply gentle pressure over the site for 3 to 5 minutes. You can ask the patient to do this, and then we must ask them to come back if the bleeding continues. Okay, if there is what we call hematoma or collection of blood, the blood is maybe bleeding inside or underneath the skin. Yeah, so we can see huge bruising underneath the skin. We call that echomosis. So these are signs that something is not quite right. We don't want the blood vein to be punctured too much. We also worried about the blood status, yeah, whether it is too dilute. I mean, panggil apa ni? If something regarding the clotting mechanism of the blood system is not working well, a patient with stroke on warfarin, for example, we don't want them to bleed. Yeah, so they need to come back to us. They need to be observed before we leave. Let them to leave the place. We need to observe them for 1 or 2 minutes, and then ask them to come back if it continues to bleed. Okay. Disposing the needle. This is the sharp bin. If you have the adapter together with the needle, they must be disposed together. Most sharp containers are made of puncture-proof material and must display biohazard symbol. As lab personnel, it is your responsibility to ensure that a biohazard container is never overfilled. Kadang-kadang kita banyak sangat kerja, kita buang, dah penuh pun masih masuk lagi. We can puncture ourselves, you know, if it's overfilled. Labeling the specimen. Look at the label there. There's a name. Yeah, you can use full name or you can use initials. Medical record number, the date the blood is taken, the time, okay, and then the initials of the person who take the sample. This can be written using a permanent marker, or you can computer generate them. Okay. Okay, labeling is always to be done after the blood is drawn. Do not label before, because we may forget, we may lose tube. Okay, and fasting specimen, and in monitoring therapeutic drug levels. So in these two situations, for example, you really need to put or document the time of collection. In other in other situations, the timing is not too sensitive lah. Dia pun tak apa. Okay. To prevent mislabeling, do not label before or after you leave the patient. Only label at the time of specimen collection. So in that way, we know exactly which patient we are dealing with. Okay. Okay. Check the patient arm after about 3 minutes to see if the bleeding has stopped. Okay. We don't really always have this luxury. Sometimes kita banyak sangat patient, we have to just ask them to go out and wait there, and only come back if there is something untoward happening. Otherwise, macam tu lah. But if we are in the hospital situation, in the ward, and then we can have the luxury of observing this. Yeah. Tape or adhesive bandages can be used to hold the pressure gauze on the side. Do not use tape on anyone with thin, fragile skin or on people with allergies to tape. Ada juga orang yang allergic to tape ni. Okay, the patient can remove the bandage after 15 minutes. Okay, after 15 minutes. Okay, so specimen must be ensured that we have labeled them and then transport to lab in timely manner. Maknanya tak tunggu selepas 24 jam baru nak hantar. Okay, some medical facilities use pneumatic tube but not always. Pneumatic tube ni masuk, dia akan sedut, dia akan hantar ke lab. Okay, if you are in the top floor or ground floor, the lab can be anywhere. You can just okay, special handling procedures. There are some samples that need to be handled in a special manner. Some specimen must be ice cool. Some specimen must be protected from sunlight. So they need to be put in ice or wrapped with aluminium foil or put in the storage where sunlight cannot be exposed to them. Okay. Butterfly needle ni tak apa. I'll skip. Yes, but you can read again. Yeah. The syringe transfer device pun it's okay. Okay, dermal puncture. Dermal puncture is the preferred blood collection technique for infants and small children. Children do not normally enjoy venipuncture and usually will not remain still for the length of time venipuncture requires. Berapa minit nak buat venipuncture? Anyone have any idea? Raudah? Raudah ada kat sini?
Saya doktor.
Okay. How many minutes does it take to complete a venipuncture?
About 10 minutes to 5
10 minutes.
minutes.
Okay, Fatini, in your experience, the venipuncture that was performed on you took how many minutes? Raudah kata 10.
Around 2.
2 minutes.
Yeah.
It's need too fast. 10 minutes is too long.
5.
I do not know. Okay, depends on your skill. Can it be done in 2 minutes? Nak buat 2 minutes is too fast lah. Time each other. Okay, I will time your. Kita dah cakap semua ni, so you can imagine what are the procedures. Yeah, we read through the manual again nanti. You imagine in your head, and then you try to do it on the mannequin. We will time berapa lama awak perlukan. Okay, and you see that as you practice more and more, it becomes more confident and the time will be less than the first time. Selecting the site for dermal puncture. Ni tadi saya dah mention about the heels, children, and we will try to use areas that we have not tried before. Okay. an unused area, and try to avoid using the thumb. Areas should be warm, pink, and free of scars. Do not use the arch of the foot, the back of the heel, or the plantar area of the foot. Reasons being this area are prone to injuries, etc. Okay. So these are the common puncture site. Yeah, we use these two fingers or here, back of the heel, side of the heels, but never on the plantar surface. Sakit ni kalau kena sini, and a lot of tendons here. Kalau kena and we have injury there, we might cause problem to the walking ability. Okay. Okay. Dermal puncture we will not perform in our lab. So and it is easy, by the way. So I will just skip this lah. Yeah. Basically, we use a micro collection, and after the dermal, again the same SOPs, yeah, where you dispose the safety lancet, and then dismiss the patient properly, and then transport the specimen to the lab. Now, with regard to the certification and continuing education, okay, so this is something perhaps in the future you may want to be certified. Okay, certification is a process that ensures successful completion of academic and training requirements. Academic means the theory, you understand the theory, the reasons why, the rules and regulation, academic component. And then training ni maknanya physical or practical training, where you will be assessed on how to communicate to people, how to get consent. Flabotomy ni kena dapat consent tau Akilah. Okay, you tak boleh pergi terus pada satu patient, or contohnya Nurul Ain is the patient, you've been asked by the doctor to take specimen from Nurul Ain. You cannot just go to her, not asking her consent, not explaining the procedure, terus tarik tangan dia, lipat dia punya baju dan terus cucuk. Tak boleh. Okay. Every single time you want to take a blood sample, you must go to her. Hi, are you Nurul Ain? Okay, just checking. Of course lah, kalau dah kali kedua, kali ketiga tu, you don't need to validate anymore lah. You know that is Nurul Ain. Okay, okay. So, hi Nurul Ain, how are you today? Are you okay if I take your blood now? Yeah, I need the blood specimen for our daily routine checkup. Yeah, if you are not comfortable, we can do it later when you are comfortable. Just tell me when it is the best time. Nurul Ain said, okay, I'm okay now. I'm free. I don't have anything to do. It's so boring to be here. Thanks God you are here. So okay, Nurul Ain, same thing like yesterday. I will be taking the blood from your vein here, and I will use the tourniquet. You may feel a little bit uncomfortable. If you want to stop anytime, please tell me. And then we do this as soon as possible. Yeah, so can we start now? And said yes, I can. So bila kata I can we start now tu is part of the consent. Okay, so see you talk like in the casual manner, tapi still professional. You explain what to expect. You explain that there is pain, but it is okay. You explain that the patient have the right to stop at any time. You give them time to think, time to decide on their own. Okay. So tadi bila kata tadi, can we do it now? The Nurul Ain said yes. Itu consent lah tu. Okay. You can have that consent, which is a verbal consent, or if you in a different situation, the consent may need to be written. Okay, please sign this consent form. Nurul Ain, before we start, as a procedure, I need you to sign this. Okay, Nurul Ain pun sign. That's another manner. How about if the person, Akilah, is a small kid? Contoh, dia boleh cakap dah umur dia 6 tahun. How do you get the consent from this kid?
I guess kalau if the kid can talk, then we can apply the same communication skill.
Yeah, ke? Just because they can talk.
Or
Yeah.
maybe we can ask the parents for the consent.
The parents. Why can't they decide?
Because they
Mana
don't
awak ni?
know.
Nampak awak? Akilah, okay, I can see you now. Because they do not know. 6 years old do not know anything?
In my opinion, yes, they don't really understand the procedure.
Do you know things, Akilah?
Hopefully, I know.
Okay. How about a professor who is 86 years old already? How do you get a consent from him?
The same like what has been explained just now. We can get the consent from him.
Yeah, how? Verbal is enough? Data dia tak dengar. Hard of hearing.
I'm not
Yeah,
sure.
yeah. Okay, yeah. Okay. And then something happened, masuk court, and then the professor said, "No, I didn't give the consent to her. I didn't hear what he said, what she said." Okay. So see, there are situation which delicate. That's how we put it. Yeah, delicate. So that's why sometimes a written documentation is preferred. So when you are taking consent from guardians, yeah, primary guardians, whether it is a kid or elderly, regardless lah, elderly tu professor sekalipun, dia very professional lah kan, supposedly can think on his own, tapi turn out that he has hearing impairment, so which may then distort dia punya ability to make decision. So in that mungkin dia boleh baca, okay, so you may want to give a written form to sign. Okay, another thing that you can do is by recording the conversation, a video recording or audio recording, although this is slightly clumsy to do, but in certain situation, patient who are aggressive, for example, or if the case is a legal battle, has some legal battle, maybe. So this in the court are also considered as evidence of giving or not giving consent. Ya, saya nak cakap pasal certification ni. Tapi ini macam training requirements. I was talking about training requirements ni tadi ni. So we understand. This is why the training is important, because we want to help people, but at the same time we must ensure that we also are helping ourselves. We help ourselves by knowing our roles, our responsibility, what to do, how to handle specimen, and how to protect ourselves legally. Legally, if anything happen. Yeah. Purpose of certification. Okay, so kalau somebody who has exhibited, during assessment that they know things theoretically, they have the good communication skill, they understand the law, then we certify. So those who have no certification, they have nothing, no document to represent that this person has achieved a certain standard. Itu je certification ni. Yeah. So purpose of certification is to protect the public by setting standards for individuals working at various levels of responsibility. This is also like degree, biomedical is also part of certification process. Yeah. The aim of any certification ni is to ensure that the worker, sama ada the doctors, nurses, dentists, biomedical scientists, they first and foremost are safe for other people. Selamat bertugas. Bila dia bertugas tu dia ni selamat dia bertugas. Bertugas selamat maksudnya people are safe from injuries, people are not discriminated against, they are treated professionally and ethically. Itu dia. So accreditation, the process that evaluate the quality of training program. So some of you may become directors, supervisors. You have to think about all this. Certification of your staff, the accreditation of the program that ensure that your staff achieve certain level of standards. To maintain certification, okay, once you have been certified, you sometimes need to maintain that certification. Medical doctors pun dia orang need to go through apa ni panggil, dia kena collect point, continuous professional development points. Nurses in the hospital dia pun ada benda-benda ni. These are continuing education. Lots of seminars, workshop, development programs. Nurses from time to time, they also being sent to phlebotomy training so that they can recap. Okay. Quality assurance in phlebotomy. This is a concept that involves all members of the healthcare team creating quality process to improve customer satisfaction. The underlying word here is customer satisfaction. Saya pakai customer lah, tapi in this case is patient. Patient. So we want to see whether they are satisfied or not. Satisfaction is achieved as a result of both the healthcare encounter. Okay, macam mana pengurusan kita, cara kita berurusan, masa kita berurusan tu, adakah cepat, adakah terlampau lambat, was it delayed or not, and then also the accuracy of results. This will contribute to the total quality management. In the past, the healthcare service dia focus more on the accuracy of results. Asalkan result tu okay, without looking at the patient as a human. So this is part of humanizing our service. We must not just look at the process in our place, but also look at the patient. In order to achieve customer satisfaction, health facilities ask patients to complete surveys or other rating system to ascertain their level of satisfaction with the care they receive. Okay. So this is how we assess. So patient requiring phlebotomy service rate the care they receive not just on lab result but also on the following: how long they had to wait for the procedure. Kalau siapa tadi buat phlebotomy, dia rasa 10 minutes is okay. Oh, jenuh lah. 10 minutes means in an hour you can only manage 6 person times berapa jam bekerja? 8 jam bekerja. 8 jam tu tolak pula. Itu ini. In total 7 hours. 7 kali berapa tadi? 7 kali 6, 32. Present or absence of bruising to the site. Selalu kan kita dengar orang komplain pergi hospital ambil darah, orang akan tanya, sakit ke tak? Nurse tu, sakit amat. Atau habis lebam-lebam. Yes, kan orang that is how the public assess, ya, elok ke tidak, sakit ke tidak, prosedur dia mencari, cari yang belah kanan tak dapat, belah kiri tak dapat, macam-macam lah dia buat. Itu pun a way they measure their perception is influenced by this kind of experiences. Number of needle sticks or attempts required. Oh, lepas ni tobat lah aku nak pergi suspect. Dia cucuk aku dekat 50 kali kot. Tak adalah sampai 50, but dia punya exaggeration macam tu. So although that was maybe the first time or the only time dia ada dah datang 10 kali dah kat suspect, but this particular one session ni dia terima experience yang tak berapa bagus. Okay. So their perception of the phlebotomy, dressing, communication skill, yeah. So we try to eliminate all this dissatisfaction, and if we are able to, then that will contribute to the quality assurance. Yeah. So when we talk about quality assurance, we are talking about a system for evaluating performance. So nak tengok betul ke 50 kali cucuk, betul ke dia kena buat 50 kali. Okay, kenapa dia kena buat 50 kali? Mungkin it's not about the Flabotomys. Maybe it's about the patient. The patient was not complying, asyik bergerak-bergerak. Okay, maybe apa lagi? Faktor-faktor lain. So this quality assurance is ensuring that things are being assessed critically and objectively, not only subjectively. Subjektif macam tadi lah, sakit sangat lah ataupun banyak kali lah dia cucuk, itu kan letih sangat. Macam tu. Nurse yang nombor 1 dulu tu bagus, yang nombor 2 ni tak bagus. So we want to be fair to the second nurse. Was it her problem? Was it something which is external factors that caused the performance of the person to be lower than the expectation of the patient? Okay, the quality assurance is set forth to guarantee quality patient care, uses specific indicators to track outcomes of patient. Okay, mungkin that second nurse dia dah perform on 100 patients on that day, and the patient who is complaining is the 100th, yang ke 100 tadi, dah penat dah masa tu. So that's why that thing happened. Maybe the nurse yang pertama, dia yang kena puji tu sebab that was the first patient of the day. Dia masih alert, tak letih. So we need to be objective on the second nurse. From 100 patients, how many errors were done? Maybe later on we see that the performance of the second nurse may be much better than the first nurse. Okay, so performance improvement addresses the performance of all workers, not just clinical personnel. Quality performance start with the physician's order, and continues until the laboratory results are given. So it's not just about the patient, it's also about the procedure, etc. Aim is to provide ways to improve, and things are being done fairly. Okay. Any questions so far?
So far no, doctor.
So far no. So I can ask you. Semua tutup kamera. Tak siapa saya nak pilih ni. Nurul Ain je yang buka.
Internet unstable.
I pray that Nurul Ain will be given the best of knowledge and understanding throughout her study, for being cooperative and showing interest. Yang lain ni saya tak tahu dia showing interest ke tidak. I hope everyone is showing interest lah. Ya ke, unstable. Okay. I pray to all. I pray that the internet will become stable. Aduh. Saya pun tak stable juga kadang-kadang kan. Kadang-kadang ada anak kacau lah apa. Ya. Okay. I think we stop here. Yeah. We come back in 3 minutes. Okay, everyone. I am sharing the attendance list link in the chat box. Yeah. So Kira, I also send the link through your WhatsApp. Can everyone quickly click on the attendance? Check whether the link is working or not. Okay. Okay. Is the link okay?
Okay, doktor.
Yes, okay.
Excellent. Right. Okay. Okay, can you see the slide?
Yes.
Yes.
All right, so we are at the end of the class. For the past 1.5 hours, we have been talking on the third. This is the third class, yeah, on the third topic, which is phlebotomy, as part of our subject hematology and immunology laboratory practices. Yeah. So when we talk about practices, it's not only about the procedure, it's not only about the lab session, but also about things like regulations, SOPs, certification, quality assurance, quality improvement, yeah, QA, QI, and then QC, quality control. Ada 3 tu, which many of you who may become future directors of labs, future supervisors, future members of the diagnostic labs in hospitals and clinics, or even research institutions, may need to be aware of, at least aware of, yeah. You may or may not need, but you need to be aware of them. Okay. Okay, Nabhan, are you there?
Yes, doktor.
Okay, Nabhan. Dah balik belum? Belum lagi ya?
Belum lagi, doktor.
Belum lagi. So how are you coming back to campus?
InsyaAllah esok saya akan bertolak ke sana lah, insyaAllah.
The university. Oh, parents hantar.
Betul, doktor. InsyaAllah. Parent hantar.
Parents hantar ke ataupun ada UIA punya transport?
Parent hantar, insyaAllah.
Okay. I was asking Nabhan if you are coming back with your parents or you are having you have the university is arranging a transport for you.
Oh, I don't think about this before.
Maksudnya apa? Balik sendiri.
Balik sendiri, doktor.
It's risky if you come back on your own lah kalau ambil public transport. So Hopefully everything will be okay, inshallah. Okay, anyway, what I want to ask Nabhan, tell me in one sentence, what you learned so far?
The theory and also the manners during the Flabotomy session.
Can I ask you more specific question? Do you remember what is the angle of the syringe, of the needle during the venipuncture?
If I'm not mistaken, 15 degree to 30 degree.
15 to 30 degrees. That's good. Siapa iPad ni? Who is this iPad? Let's call upon iPad. Saya nak panggil siapa lagi ni? Farihah lah, Farihah.
Yes, saya ada.
Okay. Can I know what is the what is contained in the EDTA tube?
EDTA itself,
Sorry?
anticoagulation agent.
Anticoagulation agent. Okay. Apart from EDTA, Farihah, can you name another anticoagulant that is commonly found in an evacuated tube?
Is it heparin?
Yeah, heparin. I mentioned it in passing. Okay. Sister Mizan. Are you there? Ada tak Mizan? Mizan, okay. Sister Mizan, can you tell me what should be on the label, what should be written on the label of an evacuated tube?
Level of specimen.
I cannot hear you clearly.
Level of specimen ke doktor?
Apa dia?
The label ya.
On the label.
It is name,
Name, okay. Name of whom?
name of the patient,
Mhm.
okay, medical record number,
Okay.
date, time, and the last one I forgot.
The very important is the collector's ID, initial, yeah. So you are taking responsibility. Okay. All right. Siapa lagi saya nak panggil? Liana Ruslan.
Ya doktor.
Okay. Tell me after the blood has been taken, what are the risks of venipuncture, post venipuncture? What could happen to the puncture site?
Maybe bruise,
Okay, a bruise. Everyone will get a bruise, but the one that we are worried about is called
overflow bleeding,
okay.
apa lagi?
Okay. What is meant by hematoma?
Hematoma.
Oh, kenapa dia tak ada jawapan?
Collection of blood into the surrounding tissue and skin layer.
Okey, itu dapat daripada website mana tu?
Tak slide doktor tadi.
Kat slide doktor. Okay, good. Thank you very much. Okay, maybe we call sister iPad ni. Siapa nama ni? Siapa yang pakai handle iPad ni?
Ya doktor.
Siapa nama ni?
Sharifah. Saya dah edit dah
Syarif-
tapi dia
Sharifah Sharif.
terkeluar balik.
Okay. Okay, Sharifah. Why is quality assurance important?
Sorry, quality assurance of the
Flabotomy procedure.
so that no injury would occur to the patient and it has to be adhere to the apa tu dia department yang establish Osha.
Okay.
Adhere to the
Okay. You're correct. Okay, we do the quality assurance to ensure that quality service is given to the patient. Okay, to the patient and allow improvement or evaluation of our service to be made in an objective and systematic manner. Okay, so it will also one of the indicators would be adherence to SOP, absence ataupun very low errors, okay, accuracy of the result is very high. And those are part of the indicators of the quality assurance, as I mentioned here. Okay, quality assurance to evaluate performance, guarantee quality of care. And there are specific indicators. So apa indicators dia? Indicators tu ada quality, accuracy, timeliness and customer satisfaction. What is meant by quality? Nur Hayati, how do you define quality?
Ni doktor.
Yeah, how do you define quality?
For me, quality tu macam quality nilai sesuatu. Contoh kalau barang macam mana dia mention dia punya tak ada istilah nak kan.
Yeah, okay. You are there, okay. Quality, Hayati said, Hayati kan tadi. Hayati said that how she perceive quality is for if she has an item, how the item serve the purpose of its function kan. Okay. So quality ni kita tengok dua perkara. You all can take note of this and remember sampai bila-bila ingat ni. Quality is defined by two things. Firstly, right first time. Right first time. Betul kali yang pertama. Okay, itu satu. Right first time. Secondly, fit for purpose. Pendek je. Fit for purpose. Right first time and fit for purpose. Okay, saya tulis kat chat box. Quality is defined by right first time fit for purpose. Okay. Okay, contoh contoh tadi Hayati ada satu item. Contoh kita ambil dalam lab lah. We have a machine which can be used for our intended purpose. It can read the sample. Dia boleh bagi tahu RBC level berapa, semua okay. So that machine is fit for purpose. But the accuracy maybe could only be given on the 10th sample. So using this definition, the machine is not of high quality sebab dia banyak-banyak kali cuba baru kita nak dapat. Dia boleh berfungsi tetapi dia tak right first time. We have to do a lot of things baru dia jadi right first time, baru dia jadi betul. So in that by that definition is not quality. If a person who is a Flabotomys, macam mana kita nak kata Flabotomys ni seorang yang berkualiti? Dia mempunyai semua kriteria yang kita sebut di atas slide yang pertama. Calm, very nice, semua. So dia fit for purpose. Ya, boleh buat. Tapi bila dia nak cuba untuk mendapatkan sampel darah tu, berkali-kali baru dia dapat ambil. So that particular service at that particular time is of less quality. Quality yang bagus ni, a phlebotomist datang, dia cucuk, terus dapat. Okay, so right first time and fit for purpose. That would define the quality. The quality is reduced as you need more attempts and you need the whole procedure ke ataupun machine ke, you need to calibrate ke, and that one reducing the fit for purpose measurement. Yeah. Okay, so that is quality. So these are part of the indicators that we use for quality assurance. Yeah, we look at the quality of our service, accuracy of the test, timeliness, and then customer satisfaction. In reality, all these four indicators, they are interrelated. Tapi dalam quality assurance kita ada soalan, kita ada activities, we have tasks to then differentiate between them and then assess. Okay, evaluation. So if we evaluate all this, evaluation is to show not only outcome but also process, so that events can be retraced to improve quality. An unwanted outcome or negative outcome is called a variance. So in the past, quality assurance, quality improvement, quality control usually are not taught to people like you. Yeah, to people like you. These are new things that are being introduced, and now we teach all this now. Yeah. Quality control is the process in which each procedural step is evaluated to guarantee quality patient outcomes. Okay, so we have to establish parameters or limits. Kalau patient tunggu, berapa lama maksimum? Satu patient kena settle dalam masa berapa minit? 5 minit? 10 minit? That is the question that the lab or the service provider must decide. Okay. Laboratory tests require preparation of both the equipment and the patient in order to ensure quality outcomes. These are the factors that will affect the quality of service. We need to have manuals that describe specifically how the procedures and special preparation must be prepared and followed. So quality control activities. Remember, quality, bahagian quality ni dia ada quality assurance, quality improvement, and then quality control. So we are now talking about quality control. Among quality control activities, firstly, checking supplies that they are not outdated. This will be your job soon. Checking for damaged equipment or supplies, calibrating equipment, performing function checks, validating results, and documentation of testing. Okay. Phlebotomy quality control. So, example, equipment used for point of care testing must undergo system check, must both have a high and low control. If the system check yields a value outside the established parameter, so you need to think of repair or calibration or replacement of the equipment. And the manner, the speediness or the delay in taking the action will determine the quality of your service. Okay. So we want the equipment to be accurate and capable of duplicating results. So how do we then do this check? Okay. We want a specimen that is drawn at 7 o'clock. Kemudian if we duplicate the specimen, duplicate the test a few minutes later using the same specimen, we would expect the result to be similar. So this is something that the lab can do as their own internal check. If there is any variation, so it is alerting us to something, to an action that we need to take. Okay. Factors affecting lab values. Okay. Contoh, potassium level or other materials or other things in our results lah. They can be affected by prolonged tourniquet placement, terlalu lama sampai all the cell, all the tissue fluids also ooze out and get into the blood, so they can affect the results. Dietary state of the patient can be a factor. Maybe the blood drawn into the tube is of incorrect volume. The order of draw may also interfere, and maybe any special instructions like if the sample must not be exposed to light. So this can also affect the lab values. Okay. So at the lab, we assess a sample that arrive at the lab. We have to reject if they do not have proper ID. If the blood sample shows evidence of hemolysis, if the tube used is incorrect for the particular testing, contoh dia nak buat glucose test, dia pakai EDTA tube. So we have to reject. Sample has been handled improperly. It should not be exposed to light, but the specimen is not covered with aluminum foil. So we have to reject. The specimen is contaminated. Maybe there is a breakage, kita nampak dia berlubang ke, dia apa ni, bocor. Clotted specimen in an anticoagulated tube. So it is supposed not to be clotted, but the specimen that we receive is clotted, so we have to reject. Okay. Inadequate sample, bagi hanya dalam 1 ml, which is not enough. So again, showing that maybe during the procedure something has happened, so we don't want to take risk. We ask for a new specimen. Incorrect time for specimen collection, macam tadilah, fasting glucose was done an hour before testing, so it is incorrect. Outdated equipment or outdated sample, sample that was taken maybe 2-3 days ago, tiba-tiba sampai kat lab, it's not fresh. No date or time, so problem with the labeling. Label does not match requisition. So apart from that, the lab must also think of the risk management. Certain hospitals, they have risk management departments. the lab directors, lab supervisors may be part of the team, or sometimes they have their, people, there are dedicated people in the risk management team. They generate policies and procedures to protect from loss or injuries. They are also there to protect procedures that will defend the institution, hospital tu, from litigation and liability, meaning termasuk juga the staff that are working at that institution. Okay, these are just to expose to you some patient issues related to phlebotomy. Yeah, I mentioned a few times already. First is venipuncture procedures. If this is improperly performed, it can cause temporary or permanent injury to the extremities, yeah, to the fingers, to the arms. Most injuries related to phlebotomy procedures are either due to malpractice. Okay, malpractice, very bad practice lah. Contohnya dia tak jaga betul-betul, dia tak swab the area that they want to take the blood sample from, so they introduce infection, or negligence. Negligence contoh macam Tony Cat tadi, dia seorang yang jaga the cleanliness semua very good, tip top, but neglect about the Tony Cat, left the Tony Cat for too long. Okay. So the burden of proof, however, always reside with the patient. If the patient has any injuries and they want to bring the phlebotomist to court, for example, it is the patient that must produce the proof that malpractice or negligence has been performed. Okay, what are other common causes of liability? Okay, misidentification of patient, breach of confidentiality, misidentification dan breach of confidentiality. Maknanya contoh sekarang ni ada social media, you rasa seronok nak cerita pasal kerja baru you as a phlebotomist, you ambil gambar pakcik ni, you tunjuk apa yang you buat dengan dia. Oh, these are all big no-no. Okay, you cannot expose them to the public without their consent. Kalau nak expose, you have to ask their consent. You then label specimen improperly, you can be brought to court for this. Performing venipuncture without consent, causing injuries to nerve or blood vessel, poor sterile technique resulting in patient infection, permanent scarring or disfigurement. So careful when you take the blood. If you have been poking and trying to insert needle for 10 times, for example, that can lead to scarring. Kalau if you are not careful, yeah. Acting outside the scope of practice, maybe providing diagnosis lah, apalah. Starting an IV or performing ABGs, these are in the territory of the doctors, yeah. So phlebotomists not supposed to do to start IV in the intravenous or perform ABGs without supervision. Mishandling a specimen, preventing liability suit. So to prevent any liability suit, court cases, you must be aware of standards of care. Do not perform procedures you are not fully trained to do. Avoid destructive and unethical criticism of other team members. Communicate with tact and professionalism when dealing with patients. Always document results and variances immediately. If we document, inshallah things will be okay. Kita ada evidence to bring. Do not give false reassurance to patient. So patient will be asking a lot of things lah. So things that are not part of the scope of job, we just say to them, you can request this information from the doctors. I do not know the full picture. Okay. Okay. So there are also personal issues with regard to risk, exposure to bloodborne. So you need to adhere to CDC and Osha guidelines. So Osha mandated that all healthcare facilities maintain exposure action plans. If someone is having needle stick injury, what to do, exposed to HIV, hepatitis B sample, what to do, etc. The vaccination for hepatitis B at the moment at any hospital or clinical setting by any employers must be they need to give the employees the vaccination free of charge. Okay. There is what we call the Osha Hazardous Communication Standard, the HAZCOM, which govern identification of potentially harmful chemicals in the workplace. So again, the people working in the lab must be aware, the supervisors must know this, yeah, and make sure that it is adhered to. So you need to know what is the MSDS, what are the regulation regarding labeling. This is also can be another cause for liability, ya, for apa litigation. Maknanya tadi pasal patient, dan bila masuk dalam lab, the hematology lab, they perform all the test. If they are not well protected, then the supervisor can be brought to court. Yeah. So MSDS sheet, this provide emergency information about the chemical product and indicate specific data about the substances, flammability of it, any agent that can react with it, and how to dispose of it. Okay, Alhamdulillah, we have finished on time. I have 5 more minutes before the Zoom stop. You have any question?
Doktor, untuk lab
Siapa tu?
session Syakira.
Kira okay.
Untuk lab session 3 hari bulan nanti, saya rasa ada certain student yang tak boleh join sebab kena quarantine. Ada 3 orang.
Dia akan menyukakan saya tu. Kenapa kena karantin?
Sebab dia CC1 case to index case.
Boleh saya tahu nama?
Nurul Syafiqah, Nurul Ain Farhanah dengan Nurhanis Fatini.
Nur Ain Fatini. Dia orang kena dekat mana? Dekat kampus?
Dekat di store.
Dekat mana?
Di store, Budiman.
Oh, the store Kuantan.
Di store, dekat OFC.
Lepas tu dia orang jadi close contact. Aduh. Dia masalahnya sebab nak arrange for OSPI tu. If I have to postpone the 3rd of November, semua kena push towards the end of the semester. We have 29 students here. Kalau 3 orang tak boleh attend, kalau saya kena postpone, maknanya 29 orang ni kena buat OSPI hujung semester. The risk is, katalah jadi apa-apa, CMCO again ke apa ke, the whole class need to be IP. IP maksudnya saya tak boleh nak conduct OSPI, kena tunggu next year. How does the class feel about this? Yalah, dia orang the students, of course I know they do not, bukan dia orang punya kehendak nak kena kan. How do we do this? Do we want to postpone or what?
Doctor, I want to inform about yang quarantine tu. Since we got the kit untuk test, tak sure lah sebab baru tanya Dr. Fuad pasal benda ni. Macam in case kalau buat test tu and then negative, is it possible untuk release awal? Tapi secara possible-nya sepatutnya boleh lah sebab ada student yang tak sempat pun masuk quarantine lagi, dia dah buat kit, dia dah buat test kit dulu and then dia being released dah from nama dia daripada list untuk quarantine lah. So mungkin kami akan update kot kalau kita orang dapat release awal ataupun tak.
Itulah, tapi katalah positif, na'udzubillah kan. Tricky. Very tricky situation. Either the 26 of you go ahead with the 3rd of November and then carry on with the OSP, and the 3 of you have to do the OSP next year. That's another possibility. It's not going to harm you. Cuma dia macam the apa lagi longer the gap between the OSP and the lab sessions, there's a possibility that you may not be able to answer as well. Kan? Sebab dah lama tinggalkan benda tu. Tu je lah. Tapi OSP tu sebenarnya dia tak susah sebenarnya. Most of you will pass lah. Will pass. Scoring highly itu another matter, but to pass to reach a certain level of standard should be okay. Okay, I do not know how to answer. We will wait and look for your update. Yeah. Okay, for the time being, that's all. Thank you very much. Wassalamualaikum warahmatullahi wabarakatuh. Thank you for that information.
Thank you, Doctor.
Thank you, Doctor.
Thank you, Doctor.
Thank you very much, Doctor.